This is a presentation about balance and falls after your stroke by the American Stroke Foundation. Why is balance important? There are lots of things that you do during the day that you need to have good balance for. Ask yourself, what are some things that you would not be able to do without good balance? Some examples are walking, standing, getting dressed, preparing food, transfers, and even just sitting upright in your chair. Balance is important to help prevent falls and injuries, makes doing our daily tasks possible, and also builds confidence that you can do those tasks safely and efficiently. Balance can be the foundation of being able to do what we need to do without risking getting hurt. That is why it is so important to continuously work on improving your balance after your stroke. So, we all know what balance is, but how does balance work? Balance is achieved by having coordination and control of your body's position and movements. Range of motion, posture, and strength are also factors that contribute to making all of your body parts work together to not only have balance, but to be able to maintain balance when you're moving. Having good balance pretty much uses all of the parts of our bodies, from our head, eyes, ears, and brain, to our arms and down to our legs and our feet. How can your balance be affected by your stroke? A stroke can affect all of those components and parts of the body that need to work together to have balance. As you know, strokes can cause you to lose some of your coordination, flexibility, and strength. Losing balance is so common after a stroke that about 83% of stroke survivors report having experienced balance problems. So not only is balance important for everybody, but it's especially important for stroke survivors because you all are at a higher risk for falling. Whether that be when you are standing up from a chair, standing still, when you're walking or going downstairs, or maybe it's when you're doing things like getting out of your car or getting up from bed. Regardless of when or how often you might tend to get off balance, learning about it and what we can do to improve our balance and decrease our chance of falling is important for everybody. In order to address regaining balance after your stroke, we have to break it down to find out what exactly might be in the way. There's actually quite a few ways that the impacts from your stroke might be affecting your balance. Maybe it's the weakness that you have on one side of your body that makes it hard to move your legs and body in general. Or if you can control those movements, maybe you just find it difficult to shift your weight between your feet. There are certain medications that you might be taking since your stroke that could have side effects that might be affecting your balance by making you feel unsteady or dizzy at times. Or sometimes being off balance could even come from not taking certain medications too. It's important that you do take your prescribed medications as ordered by your doctor to avoid feeling disoriented or weak that could affect your overall stability and balance. It's always a good idea to talk to your doctor about that to be sure if it's something that you are concerned about. A loss of sensation could be another way that could be affecting your ability to have balance. Maybe you can't really feel where your foot goes when taking a step, and that can cause you to fall. It could also mean the changes in your vision and hearing that are necessary for maintaining balance too. Lastly, you need to be able to concentrate to have good balance, and it's possible that your stroke could affect your ability to focus. Any of those things could be causing you to be off balance, and it's possible that being off balance could cause you to develop a fear of falling. A fear of falling is when that concern about falling is so big that it causes you to stop doing activities that you would otherwise want to do. It's pretty common that stroke survivors experience this feeling at one point or another, and that's okay. It's normal to be afraid to fall because nobody wants to get hurt. But it's important to know that that feeling doesn't have to be permanent, and a fear of falling can go away by learning how to be safe in your surroundings. Let's talk about why a fear of falling matters. It could cause you to avoid everyday activities. And if you're less active, you can become weaker, which then increases your chances of falling. If you're worried that you might fall in the process of going somewhere or doing something at home, then you might find yourself choosing to stay on the couch, stay in your chair, or stay in bed instead of going out to do it. That's how avoiding those everyday activities relates to less social interaction and less physical activity. Seeing your friends and family less often can then cause feelings of isolation, loneliness, and feeling depressed. Inactivity can cause you to become weaker, and in the end, increasing your chances of falling. There's a pattern here that having a fear of falling for a long time can actually increase your chances of falling. Here's a visual of that cycle to show how being afraid of falling can actually increase your chances to fall. You will begin avoiding things that you want to do or need to do because of this fear. This might look like skipping your granddaughter's birthday party because it's going to be at a park somewhere and you're worried about getting there safely. Or maybe some days you're just worried about going to the sink to brush your teeth, so you avoid that task overall. Sitting at home instead then causes weaker muscles, and then you can see how it leads to an increased fall risk and then repeats itself. In order to face this fear of falling, you need to know the risk factors that might make you more likely to fall. There's physical risk factors, which includes the changes in your body that increase your likelihood of falling. There's behavioral risk factors, which is the things that you do or the things that you don't do that increase your fall risk. And there's environmental risk factors, and this includes hazards in your home, outside, or in the community that might make you more likely to fall. Let's talk about physical risk factors first, the changes in your body from your stroke that could increase your risk to fall. I have some examples of physical risk factors, but before I reveal them, take a second and think about what they might be. Weak muscles are a physical risk factor. In addition to the weak muscles that are caused by your stroke, our muscles gradually get weaker as we get older, affecting our strength and balance and making it more difficult to do our daily activities. Weak muscles might sometimes go hand in hand with having a lack of motor control. This also relates to needing coordination of all the parts of our body to work together. This could mean if your body doesn't move how your brain wants it to, or maybe sometimes taking an accidental extra step, causing you to lose balance. Having pain is another risk factor to being off balance or falling. Be aware of the pain that you have each day and be cautious on those days that you feel more pain. Sensory loss includes things like problems with your eyesight. You need to have good vision to be able to see where you are moving. Our hearing, our ears are important for maintaining our body's overall equilibrium and balance. And sensory also includes our perceptual senses. We have to know the space between ourselves and the step we might be taking on stairs, or if a chair is behind us or not when trying to sit. Lastly, physical risk factors can also be other things like your other conditions. For stroke survivors, two common ones are high blood pressure and arthritis. Let's move on to behavioral risk factors, the things that you do or things that you don't do that increase your chance to fall. One behavioral risk factor is having a history of falls. Having a history of falls is one of the strongest predictors of future falls. If you are someone who has had a lot of falls in the past or has fallen recently, you are at a higher risk to fall again and need to be extra careful when moving. In addition to having a history of falls, other behavioral risk factors include getting up too quickly, which can cause you to lose your balance immediately, choosing the right footwear, which this includes having tied laces on your shoes, tight shoes with a good grip, and also avoiding wearing socks on slippery surfaces. Taking certain medications or not taking your certain medications are behavioral risk factors, as well as staying hydrated and well nourished from drinking enough water, eating enough food, getting the right amount of sleep, and always choosing to exercise often when you can. Now let's talk about environmental risk factors, the hazards in your home, outside, or in the community that could cause you to lose your balance and fall. Some examples of environmental risk factors are uneven surfaces, and this really includes a lot: sloped areas or hills, curbs, stairs, gravel, and grass. It's important to make sure wherever you're going is an even surface. Always check the weather before you leave your home too. Snow and rain can sometimes make the ground slippery, and if you're going outside, it's something to be aware of. Obstacles on the floor, clutter, and other tripping hazards can all cause you to stumble and fall. This could be things like rugs or power cords that you might trip over on the ground. Distractions could also include any pets or other people around that cause you to lose focus on your movements. The lighting is also an environmental risk factor. You are more likely to fall if you are moving in a dark room or outside at night where it could impact your ability to see clearly. Now that we talked about the risk factors that might make us more likely to lose our balance and fall, let's talk about what we can do to prevent those risk factors from taking effect. These tips are beneficial to anyone who is working to regain their balance. Tips for reducing your risk of falling. Exercise is the number one way to improve balance and strength to prevent falls. Focus on your movements when you are doing anything tricky, like turning, going up and down stairs, or getting in and out of the bath or bed. These are all common times when falls happen. You can step around carefully when you are turning instead of twisting your body, and hold on to whatever solid objects are around and take your time. Use your cane or walker if you have them, and get someone to help if you need it. Move at a speed that you find comfortable. Don't feel rushed by pressures of everyday life to do things more quickly. Keep floors clear of obstacles and clean up spills right away. Remove clutter so you don't have to navigate around it. Environmental hazards are unsafe for all kinds of mobility. Another tip is to always walk in the light. Use a nightlight in the bedroom and bathroom if you need to. You should always be wearing shoes that fit well and have a good grip. Choose even leveled paths and be aware of the surface where you're walking. And make sure that you're getting enough sleep and taking your medications correctly. Although the American Stroke Foundation is a good place for exercise, there are so many exercises that are manageable to do at home too. Home exercises should be incorporated into your daily routine because they are vital for regaining your balance and decreasing your risk of falling at a faster rate the more you do it. To get the most benefit from balance retraining exercises, there are 4 things that you should keep in mind. They need to be intensive. You need to do as much as you can, as often as you can. That's why it's so important to be working on things at home too. They need to be individualized, to work on the things that you find difficult based on your body's abilities. They need to be functional. You need to be practicing the everyday activities that are important to you. And they should also be progressive. You need to be moving on to more challenging activities to keep improving. Balance retraining exercises can target specific parts of the body based on your current abilities and your goals. Some examples are improving ankle mobility, or maybe it's your core that needs strengthened to help you balance. Exercises can also focus on coordination or sensory orientation. Or maybe if you are someone who has good balance while standing, but you want to improve your balance when you're walking, then you should be doing exercises that target your walking stability and posture. It's important to know how your balance has been affected by your stroke, and use that to guide which target areas are best for you and your exercises. In summary, balance involves the coordination and stability of our bodies and our surroundings. A fear of falling can increase your fall risk. You can control ways to prevent falls. Balance is important to do day-to-day activities, so you should be doing your exercises at home. To regain your balance after your stroke, remember the things that you can do to prevent falls, and overall feel confident about doing your daily activities safely.